The number of COVID-19 cases continues to surge exponentially. Hospital beds are filling up quickly.
With hospital emergency rooms being overwhelmed by COVID-19 cases around the world, new solutions are being sought out. TELUS Health, along with 7 other provincial health authorities, have locally expanded the home health monitoring solution.
Can immediately help address capacity issues. 5 to 10% of COVID-19 patients will require hospitalization, but those with mild to moderate symptoms could stay home.
Surrey Memorial Hospital, where I work, was the first place to take COVID patients. Fraser Health identified us, and we volunteered to start being the center to bring those patients in for a lot of reasons, actually, back in the beginning of February. We were watching the experience come out of China, and we were starting to understand what was happening in Italy. When we thought about how we're going to organize resources for these patients, we realized it wasn't just about thinking about how many ventilators we have or how best to put patients in the hospital. We realized if we wanted to use our resources effectively and not be overwhelmed like Italy was, we had to be very thoughtful about how we flowed patients through the system.
Patients receive an email inviting them to download an app that connects to the remote patient monitoring platform. Using a web-based dashboard, clinicians can then remotely monitor COVID-19 patients with an app, a thermometer, and a simple protocol guided by the health authority.
We also knew from the Italian experience that one of the worst places for spread of the disease was actually hospitals. The outbreak in Italy started in hospitals and spread through hospitals. And we wanted to ensure that our most vulnerable patients weren't in a place where they would be exposed to the disease.
One single clinician can then track 200 patients or more simultaneously to ensure a proactive trigger-based triage. That's 10 clinicians for at least 2,000 patients, all monitored outside of the hospital.
More than 400 COVID-19 cases in BC have benefited from home health monitoring.
We're not just the largest ICU in Fraser Health, we're also the provincial center for communicable diseases, the biocontainment unit for really severe outbreaks. And we had a lot of training around that. We also are a lot of experienced researchers in the critical care department in Surrey. And when you have a new disease and you don't understand that disease, that's really what research is for. It's to generate new knowledge. We created a big team, senior leadership in Fraser Health, the innovation group. We recruited patient partners to do patient-oriented work. And we also look to our frontline workers like nurses and RTs.
Clinicians can provide medical advice, recommend alternative treatment, or decide if medical intervention is required. This will reduce unnecessary trips to the emergency room, optimize clinical resources, and relieve pressure on our healthcare system.
So there was already a thoughtful approach to considering how to keep and treat patients at home using new technology. And because we were so focused on trying to come up with something new to solve these unprecedented problems, we found all those pieces of the puzzle in play. And we started with a virtual hospital concept, effectively, to make sure that all the things we were learning about the disease in the hospital could be translated into community-based care.
Need to invite a family member or another person to join the visit with you? No problem.
Home health monitoring by TELUS Health has been successfully in use since 2013, remotely monitoring thousands of patients and currently aligned with the Canadian CDC during COVID-19. In Surrey, I'm Leah Bolton.